Hello there, Jeanice Mitchell, pelvic floor physical therapist with at myPFM, myPelvicFloorMuscles. Welcome today. We are going to go live with Nicole Cozean with Pelvic Sanity to talk about interstitial cystitis. So she will be joining us soon. Hello, everybody coming in. So nice to see you. Hope everyone's having a great day, and we look forward to having a great discussion here today on interstitial cystitis. So Pelvic Sanity is here. Now you just need to join. So Pelvic Sanity, click the little thing that says ask to join. Hello, happy pelvis. Nice to see you. And Louise. Excellent. So nice to see you guys joining. We are just getting started here. All right. Nicole will be joining us momentarily. Hello, Embark. Andrea. There's Nicole. Hello.
Hey, hi. How are you guys?
So nice to see you. Almost in person, huh?
I know, right?
Yes.
Can you guys hear me okay and everything?
I can hear you. Can you hear me okay?
Yeah, perfect.
Okay. Great. So nice to have you, Nicole. Before we get started with the interview, I just want to give a little bit of my personal experience with your page. So yeah. I've been so very impressed with all of the information that you're giving on interstitial cystitis. So if I get questions or if I have people, I'm sending them your direction. And I really appreciate all your expertise and you being willing to share it with us today. So thank you.
Oh, absolutely. Right. Thanks so much for having me.
So let's get started with, if you could just tell us a little bit about yourself and how you started specializing in the area of interstitial cystitis.
Yeah, so I'm a pelvic floor physical therapist. I have been practicing for about 13 years now. I started when I just wanted to do orthopedics in physical therapy. I did not think I was going to do pelvic PT, but I very, very quickly, within like the first 6 months, actually got to be very into pelvic PT, and I happened to treat a lot of pelvic pain at that time. And I kept having people with interstitial cystitis come in, and this was 13 years ago, when the information was even about the condition itself, much less how pelvic PT could help, was very, the information was like next to nothing. But even then I was helping a lot of people, and I had a very much a different picture of what living with interstitial cystitis could look like than what I was reading on the internet. And so fast forward 10 years, I got a lot more experience under my belt. I ended up opening my own pelvic floor physical therapy clinic, which is in Orange County, California. It's been here for about 2 years now. It's called Pelvic Sanity. I've got 4 physical therapists. We only treat pelvic floor. We treat men and women. And about the time when I opened the clinic, I also had written the interstitial cystitis solution. And that was a book that was supposed to be of hope that you can get symptom-free or close to it, or much better than you are right now, with, of course, the emphasis is a little bit on pelvic floor physical therapy. We'll go into why I feel like it's such a big, important aspect of the condition that's been overlooked by the medical community for a lot of years. And so that's where I ended up writing it. And I looked back, and there hadn't been anybody except for Dr. Moldwin, who's a urologist in New York. He wrote the Interstitial Cystitis Survival Guide, but when it was 20 years old, and there was a lot of information in there that was outdated. And so I sit with him on the Interstitial Cystitis Association board. And so I was like, hey, nudge, nudge, are you going to write another book? And he was like, I get around to it, but maybe not. And so I was like, okay, well, I'm going to. And so I did. Nice. And it's been really helpful, I think, to a lot of people. One of my passions is to help people, not just in my own clinic, but also beyond those walls. And that's why I'm on social media, and that's why we wrote the book.
Yes,
so that's exactly my story.
Thank you so much. Awareness, that is really about what we're about, awareness and hope. And
Yes.
with technology now, we have so many amazing opportunities to reach people that we didn't have before. So it's really exciting, really exciting.
Yeah.
From a technology standpoint, everybody, we are trying to have these segments be able to be saved into Instagram Live TV. And so we're going to cut it off just a little bit before 10 minutes. So we're going to have 4 10-minute segments. So we'll discontinue it and then restart up. And then hopefully, if all goes well with technology, I'm able to save it into Instagram TV. But you can watch our stories and we'll let you know. And hopefully it goes well. Okay. So we have a lot of questions to get to. I'm not sure that we're going to be able to answer all of the questions today. If we don't, the questions that have been submitted, we will answer them later. And if you're asking questions in the live interview today, if we can integrate them into what we're talking about, we will. If not, then we will answer them later, or you can direct message us. We're very much about getting the information out there. So thank you guys for joining us, and we appreciate you being here. All right. So can you give us, Nicole, just a little bit, a summary of IC, what it is, how do you know you have it? Just basically a summary, and then we'll go into the questions.
Perfect. Okay, so interstitial cystitis in a nutshell, and I know there's a lot of different names for it: painful bladder syndrome, bladder pain syndrome, interstitial cystitis. Some people even call pelvic floor muscle spasm with urgency of urination, IC. But it is a diagnosis of exclusions. And what that really means is that when you go to get your medical testing, there is no definitive diagnostic test right now that can tell you, yes, you have IC, unless you're in the small subset of people, 10%, that actually have Hunner's lesions in the bladder. And so really at the end of the day, what you're looking for your urologist or your urogynecologist to do is basically tell you you don't have anything way more scary like cancer or anything like that, or some other thing that just isn't fitting the IC diagnosis. And so really it's, again, a diagnosis of exclusion. So interstitial cystitis is considered a chronic, painful bladder condition. But with all the research that's coming out now, we know that it is a blend of 3 things. It's a blend of bladder symptoms, it's a blend of pelvic pain, and it's a blend of nervous system, what we call upregulation, or where the nerves firing into the bladder are sort of going a little bit haywire. And that creates the 2 primary symptoms are urinary urgency or frequency and or pelvic pain. But one of the things to realize is that this condition, and notice I didn't call it a disease, I called it a condition, can manifest in many, many, many different ways. And so there are some people that have urgency of urination, but no frequency. They can actually hold it okay. Some people have to go to the bathroom a ton of times a day. Some people don't have as much pain as others. Some people are diet sensitive. Some people aren't. And so I think that really the many ways that it can manifest really just speaks to the fact that it's a multifactorial condition. Okay. It's not just about the bladder anymore. We used to think that all of the researchers used to think that it was a bladder-centric condition. That's where you hear a lot about the gag layer and the interstitial lining of the bladder, and that's where the name came from. But now that they're studying it a lot more, it's the bladder, as Ken Peters, who's an excellent urologist at Beaumont Hospital, calls it, the bladder is very, very likely and an innocent bystander in a much larger pelvic pain condition that happens to have the bladder symptoms as a primary manifestation. And a lot of people think that might be overwhelming to hear, but I always am saying that is actually really positive because
yes.
There's a lot of things that can be, go ahead.
Well, we have 5 seconds.
Oh, shoot.
Oh, I know. Okay. So we're going to end and then we're going to rejoin. Okay. Yeah. So everybody from technology, we're ending and then we're restarting so we can save this into Instagram TV. Hello, we're back talking about interstitial cystitis. This is segment number 2. with Nicole Cozean with At Pelvic Sanity. Hello from Iran. I'm so happy to see Ghazal. Hello, everybody. Thank you for coming back. I'm hesitant that I'm going to be able to save it into Instagram TV, but I'm hopeful. So, all right. Happy Pelvis is back. Pelvic Sanity is here. And great.
Perfect.
Yes. Okay, we're back. Good, good. So that was a wonderful, and I'm sorry to cut you off.
No, that's okay. Do it.
Yes. Okay. So that was a wonderful definition and very succinct. So
yeah. So what we want to make sure that people understand is that there are many, many areas of intervention where we can do treatments to address each of those areas, right? The bladder, the pelvic floor, the nervous system, the mental aspect of it, and everything else. So that should be really exciting, right?
Yeah.
Is that there's a lot of ways to intervene, and so that's where I get real irritated a little bit when we talk about a cure and we're trying to wait for a cure, and really at the end of the day, there's not going to be a pill or one thing
not
that's
magic.
No, it's not. But that's okay because we can still, there's a lot of medical things that don't have cures. And that does not mean that we still can't live happy, healthy, pain-free lives.
Yes.
And so with IC. And so
there's hope.
That's what
there's hope.
There is so much hope and so much so many ways. And so
Yes.
that's what makes me really excited. That's why I wrote the book.
Good.
And that's why we're excited to spread the awareness.
So after we're done with this, I'm going to put up a link to your book on my story so that everybody can see what the book is, and is it on Amazon?
Yeah, it's on
Amazon. Wherever we can buy it. Okay, so I'll post that link. Great. All right, so how we're going to start going into the questions here. How can you tell if your symptoms are attributed to IC, which is interstitial cystitis, which is a mouthful, or pelvic floor dysfunction?
This is a great question. So we're talking about interstitial cystitis and how to determine whether or not you have pelvic floor dysfunction or whether you have IC. And really, at the end of the day, there's a study that came out that said that 90%, and I even think that's a little bit low, of people that have IC also have some form of pelvic floor dysfunction. And so at the end of the day, they're really, really intertwined. And the pelvic floor can cause or exacerbate any symptom of IC that you're having. And so what is important to sort of differentiate out in your treatment is you need to address the pelvic floor part, whatever percentage that is for you. Now, for somebody that's very diet sensitive, very bladder centric in their symptom presentation, then that means that pelvic floor might be some part of it, but not 100%, right? There are other people where it's the other end of the spectrum. And so because those two things, IC and pelvic floor dysfunction, are really intertwined, it is hard to say whether you have one versus the other. And again, there's no diagnostic criteria for interstitial cystitis, including a cystoscopy. So no person can look in your bladder and say you have IC other than Hunner's lesions. And so we do have a pelvic floor dysfunction screening protocol to look at some of the other symptoms that might lead you to believe you do have pelvic floor dysfunction. Things like risk factors like having fallen on your tailbone or back, whether or not you have other symptoms of pelvic floor dysfunction like incontinence, constipation, difficulty emptying your bowels, painful intercourse, things like that. Low back pain and sciatica can be a sign of pelvic floor dysfunction. So there are other things that are non-IC related that pelvic floor dysfunction can also be around. But to try to distinguish whether or not you have pelvic floor
one or the other
is, I don't think I don't really think it's worth the time to try to really tease that out, except for to get to a pelvic PT so that you can assess whether or not you have pelvic floor dysfunction, and you can address those symptoms and then see what happens to the IC symptoms. If they go down, a lot of them were causing were being caused by your pelvic floor. If they don't, then that means you might have a little bit more bladder-centric symptomology of your interstitial cystitis symptoms. And then you can look towards more bladder-focused treatments like installations and those other things that we'll talk about here in a second. Okay. But it can sort of help to sort of tease out what symptoms are coming from which area. Does that make sense?
Yeah. A question came in, how about the blood test? So I'm not sure, is there a specific blood test that can identify anything that might lead to IC?
As far as I'm aware, as for all the research that I've done, there is no blood test that can definitively say that you have IC. Sometimes the blood test can look for other markers of inflammation and stuff like that that might lead you to have another autoimmune or inflammatory condition. But there is no definitive blood test for interstitial cystitis. Yeah.
Okay.
So,
good.
Yeah.
Now, does IC, okay, so everybody joining us, hello. We're going to keep trying to repeat some of what we're talking about. So we're talking about interstitial cystitis, which is painful bladder, okay? So does IC sometimes feel like a UTI? So that's interstitial cystitis, and does it feel like a urinary tract infection? So can they feel similar?
Absolutely. In fact, people will very much get those two things confused a lot of times. So in the book, I talk a lot about having like a phantom UTI, where you swear that you have a UTI, you go get checked. Maybe it even does a dipstick positive, but it cultures negative. And so, what does that mean? You know, and then sometimes you really do have a UTI. Where your urethra and you do have a bacterial infection that irritates the pelvic floor and the urethral tissue. And then, but when the bacteria clears after your round of antibiotics, then you still have the symptoms of a UTI, even though you're technically rid of the infection. So it gets really confusing. And if your doctor is working under the assumption that IC is rare, which is not true, it's one of our IC myths, that's IC myth number 2, then they're maybe not thinking about that. Maybe they're going to think like, oh, well, maybe you just don't have maybe you have an infection that we need to get another antibiotic for, or something like that, which it really could be what we really need to
I'm sorry. I was responding to interstitial cystitis joined. Right when you said that.
Perfect.
Yes.
So yes, the IC can definitely feel like a UTI, and whether you actually test positive and culture positive for UTI, that doesn't necessarily rule out that you don't have interstitial cystitis either, because the symptoms of urgency and frequency and pelvic pain can persist even after a infection is present. And so what you want to do is just make sure that you're getting the right testing to see if you actually do have an infection, get on the appropriate treatment if you do from your physician. But if you're culturing negative, and that negative test after negative test after negative test, that's when you need to start looking elsewhere at potentially interstitial cystitis as a thing, or pelvic floor dysfunction as a cause of your symptoms.
Okay, very good. So testing negative over and over and continuing to have these symptoms, we really need to get that looked at.
Yeah, further, mostly by a pelvic PT at that point, because at that point, it's not necessarily going to be helped by more and more medications that clearly aren't working for an infection that probably isn't there. So.
Okay, great. Thank you so much. We have about 40 seconds left here. So the next question that we're going to talk about is a long one. So come back. We're going to talk about, is cystoscopy and hydrodistension useful for getting an IC diagnosis? So I know if you're not a medical person, all of these words are really, really big, right, and confusing. Yeah. So we're going to end and we're going to rejoin, and we're going to talk about cystoscopy and is that helpful with identifying interstitial cystitis. Hello again. This is segment 3 of interstitial cystitis with At Pelvic Sanity. Hello. Welcome. Hello, everybody. I'm glad to see that you're joining in. We're talking about interstitial cystitis with At Pelvic Sanity. we're going to go live with @pelvic. So she should be joining us shortly. Hello. I'm so glad to see you guys. There we go. I have some bad news from a technology standpoint.
Oh, whatever.
So how I envisioned that this would work, and that when I've done some trial runs alone, is that if you cut it off right before 10 minutes, you can save the live video, but it's not letting me save. So there's really no point in it right now of cutting it off.
Okay.
Let's just do this 20-minute segment. We'll do this 20-minute segment, and this will be live for 24 hours on both of our stories.
Perfect.
So I encourage you guys, if you want to see this, to get your own device and record it right now, because at this point, we don't have a way to save it. If we figure out something, we'll let you know. But all right, so we're jumping into cystoscopy and hydrodistension. So can you, in layman's terms, tell us what that is, and is that helpful to determine whether you have this interstitial cystitis?
Yes. So what a cystoscopy is it's like a little camera that's inserted up through your urethra, and which is the stuff where pee comes out.
Where urine comes out.
Yep. So you put that, the urologist will put that little camera up there, and then once it goes through the urethra, then it's actually inside the bladder, and it can actually look around and see the lining of the bladder. So this is where there's a lot of confusion in the medical community and with patients because a lot of doctors are still saying that they can diagnose IC with a cystoscopy. And that is not true. And that is by the American Urological Association says that cannot happen. So what you look
They can only diagnose Hunner's lesions. Correct.
They can only diagnose lesions through there. And so what sometimes goes on is that there's little red, a lot of times where IC is also called angry bladder syndrome, right? Where the lining of the bladder looks red and irritated. And so some people say that, oh, well, then you have IC. It doesn't rise to the level of actual ulcerations or actual like little wounds in the bladder lining, which is what Hunner's lesions are. And so it gets all confusing. But bottom line is that your urologist cannot diagnose IC with a cystoscopy, a little camera, but you can see if there's inflammation in the bladder wall and everything else. But the really interesting thing, and this is where pelvic floor physical therapy and stuff comes into play, is that there's just as many people with quote unquote normal bladders that also have those areas of irritation that don't have symptoms. And so that's why it's not super specific to say that just because you have those little areas of irritation, it doesn't necessarily mean that you have interstitial cystitis. It's just one other little check mark of a box that basically says, there might be some inflammation going on, but we can't say definitively that you have or don't have IC. So it gets real confusing when there's normal bladders that have those little.
So that's hydrodistension. That's when they.
So that's just looking. And then the hydrodistension sometimes is what they do. They actually put a solution, a saline solution, and they fill up your bladder, right? And the goal of that, is based a little bit on that interstitial cystitis is an actual bladder lining problem. So the goal of that is to overstretch the bladder, actually create a little bit of a insult or to the bladder lining itself, so that it influences a healing process to come into the bladder line.
Kind of overstretch it a little bit.
Overstretches it a little bit. So some people report improvement in symptoms with that. And it basically stretches the muscle of your bladder called your detrusor muscle. You had an awesome video on that.
Thank you.
Yeah.
Thank you.
So,
if you guys didn't get a chance to watch it yesterday, I posted just a very basic, simple explanation of what the pelvic floor muscles and the detrusor muscle is. And the title of that post is straining to empty your bladder. So if you're straining to empty your bladder, go check that out and look at the basic mechanics there.
Well, and with IC, a lot of times the red towel that you had over that bladder, the detrusor muscle is actually spasming, but it's not producing enough oomph for your
to push it out.
out well. And so that's where the bladder spasms actually come from, that you might feel right above your pubic bone or below your belly button. So that's also something that sometimes hydrodistension can help with that. Some people report improvement in symptoms with that, and sometimes that can flare people too. So it's you know, six of one, dozen of the other sometimes. So it's one of those things that if you and your urologist decide that that's a good thing for you to do, it's an okay thing to try. Just remember,
it's not going to hurt you. Well, it could potentially inflame you.
It's not going to cause damage or anything like that.
Not going to cause damage.
Right, at all. And it's a decent thing to try, but it's one thing that you need to keep track of. And if it helps, then that needs to go in the toolbox of, potentially helps, that could help you get out of a flare or something else. And if it doesn't, then there's no sense in continuing to go back to do it again and again, right? Then you need to look somewhere else.
Exactly.
That kind of thing.
Good. Okay, now urethral dilation. So we're still in the diagnosis category here. So urethral dilation, that's basically the urethra is that urine exit canal that connects from the bladder to the outside where urine passes through. So that's stretching of the urethra.
Yeah, stretching of the urethra. Okay, so hold on. I'm going to actually go to a couple of these questions on the back where it says it actually can cause damage, and then someone else says how, and then that person said the bladder is not supposed to be stretched like that. So that actually brings up a decent point, that this is all based on your urologist's ability to know how much solution to put up in there, right?
Okay.
So there's a test called a urodynamics test where they can do that and look at your bladder capacity. So it's not like they just go and put in a crazy amount of, because
we don't want it to
blow up your bladder, right? They do it so that it'll be just above where your capacity is, and a safe amount usually. And so with IC, a lot of times the bladder lining actually, or the bladder wall and the muscle doesn't, because people are going so frequently, then the bladder never does get stretched out that far. And then that can perpetuate the urinary urgency that you guys feel. So sometimes that's why it also helps. It actually helps that muscle to get stretched out so it can fill better, not feel
because
better,
it's meant to expand. Better. Yeah, kind of like the water balloon, right? When you're filling a water balloon at the beginning, it's small. And as you're filling it, it fills and expands. So you have a filling phase, you have a storage phase where it's meant to hold things, and then an emptying phase, right? Okay.
Right, exactly.
Good.
So I just wanted to make sure we talked about that.
Yeah, and if you guys have any more feedback, please just continue to send it in and we'll try to integrate it. So going to urethral dilation.
Yes. So urethral dilation is more for if you have like scar tissue or an actual blockage in your urethra that is impeding the ability of your bladder system to work. Okay. So typically it is not used as a treatment for interstitial cystitis unless your urologist or your urogynecologist actually sees something that might be helpful for. And in that case, if you already are having symptoms of pelvic pain, I would, if you're not having an actual like obstruction in that area, I would highly recommend going through the pelvic physical therapy route first. Try to calm down those little muscles around the urethra.
Wrap around it.
Because a lot of times that actually make you feel like there's something stuck there, but it's actually pelvic floor muscles that are doing it.
Might just be the muscles. Yep. Before we jump into more of these questions, I'd like to just kind of have you respond to this feedback here. So they didn't do the urodynamics for me before the hydrodistension, and hydrodistension is no longer needed to be diagnosed. So in segment 1, we talked a little bit, well, quite a bit about how to diagnose IC. And so it's a diagnosis of exclusion. Do you want to just quickly recap that so that we have that in this segment?
Yeah, diagnosis of exclusion. The AUA and the FDA recommend that, actually, definitely the AUA, I'm not actually sure about the FDA, but the AUA, American Urological Association, does rapid hydrodistension. If you go to hydrodistension as a treatment, and it does not.
I'm having a hard time can you hear me okay? Because you just kind of froze for me.
Oh, no, I'm okay. Yeah.
Okay, good. All right.
Yeah. So hydrodysplasia, correct, is not needed to be diagnosed, is not needed for diagnosis.
Yes. Yes. So we're all on the same page with that. We're not advocating hydrodistension.
No.
And we're not advocating that it be used as a diagnosis for IC.
Right. It can as a treatment if you're a urologist and you decide that that's good.
Yes.
Perfect.
So if Tara, if you have any other feedback on that, send it in here. Okay. So let's go to prognosis. Okay. So the question is, if you're diagnosed with IC, can you get better, or is it hopeless?
Yes. So the answer is absolutely you can get better. The first sentence of my book is thousands of people with interstitial cystitis live happy, healthy, and symptom-free lives, and so can you. And so there is definitely hope. It is not a death sentence of a diagnosis. Now, that's not to say that it is not extremely challenging. It can be extremely challenging. So I want to make sure that we're not all like, oh, rah.
Minimizing it in any way.
Absolutely not. It can be extremely difficult, and it can take a really long time and a lot of effort, time, money, energy to get better, but you can get better wherever you are, whether you're a severe housebound person with IC to someone that just, it bothers you to go to your kids, game, anywhere in between, there's always room for improvement, and there's always something that you can intervene on, because there's so many things that are involved with it.
So many, and then just finding the balance and what works for you. So really having a good healthcare team to help you. So you need a good urologist, a good pelvic floor therapist, nutrition aspects. I know we're kind of jumping around here, but and then the nervous system regulation as well.
So I mean, I think the biggest thing when finding and putting together your medical team to help you deal with IC is that you need to find somebody, and the internet these days is super awesome for this type of support, because there's a lot of people like myself that are doing remote consultations to help sort of guide you in your own area where you can look for help where near you. But you need to find somebody that's passionate about helping somebody with interstitial cystitis. There's a lot of urologists and urogynecologists that don't like the pelvic pain aspect of that type of urology. And that's okay. And we need all different types of doctors and practitioners but you want to find someone that's passionate about treating IC and that has experience treating interstitial cystitis and that is up to date on a lot of the research. And so there's really good, our website has a lot of good resources for that. Interstitial Cystitis Association, Interstitial Cystitis Network have very good providers.
So your website is pelvicsanity.com?
Under either IC solution or interstitial cystitis. We have a lot of resources for people, symptom logs and stuff from the book and everything. But the IC Association and the IC Network have dedicated people on their website that treat interstitial cystitis as a passion. And that's where we really need to find a lot of people. Or if your urologist doesn't have that expertise, they need to just be willing to work with you and really like take your information that you bring to them and be like, oh, help you figure it out as a partnership. And so I really want to stress that if one person doesn't work for you, then you can move on to the next one, because there's a lot of different people, tons of options. So
we're going to jump off. We're going to work on these two questions here. Although, we have so many questions. We're just, it's amazing the amount of feedback we got. And so we will answer all the questions. It won't be today. We might do some written responses to the questions so that we make sure that we address all of them. But everyone that submitted a question, we will answer. But let's jump to these. You guys that had the time and are engaged with this right here, okay? So can diet help to improve interstitial cystitis symptoms?
So really good question. Absolutely it can, but I do want to point out that there's a lot of different types of people with IC, right? There's some people that are very diet sensitive, and there's other people that really aren't. And so I feel like people need to really have some self-awareness of what exacerbates your symptoms. And so right. So doing a symptom log, doing a food diary to really see what does fluctuate your symptoms is really important, because I feel like all too often people come into my office that have read online that they need to follow this super strict IC diet and they can't eat anything, and they're not getting good nutrition from it because they're restricting their food so much and they're scared to eat. When we start doing our work, they're actually not very diet sensitive at all, right? Their pelvic floor maybe is a little bit more, their nervous system is a little bit more upregulated, and diet really isn't a problem at all. And so then you're restricting your food for no reason. Now, the gold standard to find out if you're diet sensitive is that you do a full elimination diet. And that takes a little bit of time and effort, but a couple of weeks. But that's where you eliminate virtually like everything, like soy, like the top trigger foods. And we can put up a link to this somehow, some way on how to do a proper elimination diet. But you basically eliminate soy, dairy, MSGs, artificial sweeteners, basically everything where you think it's like, what am I going to eat? And then you slowly start to add back in certain aspects of different food groups while you're tracking your symptoms, so that you can really see of the things that you need to eliminate, that you're only eliminating the things that are causing your symptoms, and that you are improving things, make sure you're eating nutritiously to support healing. And so, so that's kind of the short answer.
So yes, but it varies. It's not always.
Short answer varies. Don't restrict too much.
Two more things that I'd like us to cover before we end, and they're pretty big topics. So one is the question about autonomic dysfunction as an underlying pathology for IC. And then also the bladder installation. So if we could cover both of those questions for our group that's here. And
Okay. Perfect. Okay, so let's talk about the autonomic dysfunction first. So you have two types of nervous systems in our body, and this is all part of the involuntary nervous system that we have. We don't have real control over this other than to do some nervous system calming. We can control that. But so here's the deal. So our fight, flight, freeze response is like the anxious one, I have to run away from a danger.
Like where your heart, just something happens and you're like, you can just feel the rush, right? You can feel the rush and
Right. So that system is usually overactive in people with interstitial cystitis. And the parasympathetic nervous system, or the rest, relax, calm nervous system, is actually not turned on very much. So I talk about it like volume knobs. We need to turn down the nervous system a little bit. That's the fight, flight, freeze. And we need to turn up the rest, relax, chill, calm, pee, well, poop, good, have sex if you want. That nervous system needs to get turned on. And so there is some preliminary research that shows that people with interstitial cystitis actually have other symptoms of autonomic dysfunction, where their heart rate and stuff doesn't really respond as good to certain areas, or it's like higher levels, but that's still pretty preliminary. But I do know that when we are looking to decrease the sympathetic nervous system that's always on, we need to get our nervous system way more calm, because that supports proper bladder emptying, proper bowel emptying. Because if you think about it from a evolutionary standpoint, if you're running away from danger, you don't want to have to stop and pee and poop, right? Or digest your food. It's like, so now we need to support that area. And so that's where diaphragmatic breathing, addressing any underlying anxiety disorder that you have, looking at all of the mental health aspects and ways to combat the way that your nervous system is working. That those are really good, important things to add to your team. And
Good.
so, yeah, that's where I'll talk about that. Yeah.
Do you have any tips on your website? Like if we point them to your website, do you have any videos or any handouts on calming?
You know what? I do not, but
I think we're going to be working on that.
I think so too, for sure.
Because
we have a couple of like in our clinic, we have nervous system calming, diaphragmatic breathing. But
yes.
my 2019 goal is to do more videos, and
yes.
so we're going to be doing it
exactly.
Specifically for IC.
Good.
Yeah. So
good.
We got to get on.
Yep. Tag us, and we'll tag you, and we'll keep getting the word out.
Perfect.
All right, and then lastly, we have the installations. So can you tell us a little bit about bladder installations? And, I understand that that's being pushed in certain areas. So helping people to understand what it is the purpose, and give them some guidance.
Yeah. So installations are basically medication. They call them cocktails because the gold standard now is a concurrent cocktail. There's a steroid in it usually that helps to decrease inflammation. There's usually some sort of lidocaine or like numbing thing that you put into your bladder, and then you're asked to hold your bladder as long as you can, maybe a couple of hours, and then you pee out the medication. So installations the premise for them is there's a bladder component to your symptoms. Okay. For some people, they can totally help. And if you are diet sensitive, and your pelvic floor therapy is, taking care of 20% or 30% of your symptoms, but then there's still bladder spasms and stuff like that, sometimes you might want to start looking into bladder installations. Typically, they're performed either once or twice a week for a series of like 6 weeks or so. And you go in and you get your installation, and then you go home. And what I really encourage people to do is that if you're going to use that as a medication tool, then you track your symptoms for about a week before, during the installations, and about a week after, so that you can see if that actually helps you. A lot of people say that their urologist pushes installations a lot. Now, urologists are going to give you what they can offer you, and urologists are doctors, and they can offer medications into.
They want to help you.
So they want to help. Now, I personally think that on the AUA guidelines, installations are on that list of AUA guidelines, which we also have links to on our website stuff. Right.
So go there if you want to see the AUA guidelines.
Like where they are in the thing. They're high up in the medical treatment section, so they can be good. But if they don't work, we don't need to keep going there. You got to look elsewhere, right? And if they help you, heck, that needs to be put on your list of flare busting plan and your go-to thing that you can do, because you can learn to do it at home and all that stuff. But one of the things is that it does go right up into your urethra, though. So if you're also having urethral pain and urethral spasms, then, sometimes they can actually flare. So it becomes, this is why you need a team to help you. And I think the pelvic PT is the best person to drive that little team, because then, we can schedule pelvic PT right after your installation so that we can calm down any irritation to your urethra. Or if it's just too much, we can do pelvic PT first for a few weeks to try to calm down that area so that you can tolerate an installation. So we can really do a lot with your medical team to help get what combination of therapies is going to be the best for you and your symptoms. But the real key is to track. You got to track your symptoms.
Write it down.
To go through and decide. There's too many things going on. We need to be real, good about it. You
can't rely just on your memory. So you've got to write it.
Because it'll trick you.
For those of you that may have missed it in the first segment, Nicole told us that 90% of people with interstitial cystitis also have pelvic floor dysfunction.
Yeah.
So it's a very high likelihood, if you're having some of those symptoms, that you also have pelvic floor dysfunction. Unfortunately, fortunately, pelvic floor dysfunction is we're increasing the awareness, right?
Yeah.
But still, there's a lot of people that don't know that those two go hand in hand. So be your own advocate. Ask for a referral to pelvic floor therapy. And if you're not seeing a urologist, ask for a referral to urology too. So they are a very important component of your bladder health team.
Totally. And I'll just say one other thing too about pelvic PT is that our field is budding, right? There's a ton of people, but we also have some people that are super focused on postpartum and super focused on pelvic pain and stuff. And those two treatment avenues are pretty different. And so you just want to make sure that just because one pelvic floor physical therapist might not have worked with you or for you, that you can try, if you can, to go to a different one with a different
You can't say
skill.
that just because you got a haircut and you didn't like that haircut, are you not going to get your haircut anymore, right? So don't give up on it if you didn't have a good experience.
Yeah, absolutely, because it can be really helpful. And even if it's just a personality clash, you know, I mean, even that, this is an intimate thing and you have to really like your physical therapist too, you know, so don't be afraid to try other options and stuff, because it's a really big area, and pelvic floor dysfunction can either be causing or can exacerbate your symptoms of IC. So it's really important to make sure that you get that addressed and you keep addressing it.
So before we go, Nicole emailed me. She has a really nice pelvic floor screening tool that you can go through and kind of self-evaluate some things. And so I'm going to post that in our links, hopefully today or tomorrow. And so you can go through that and give yourself a little evaluation. So is it possible that the pelvic floor is causing some of your dysfunction? And she goes through a really nice sequence of questions there to help you identify. So thank you for creating that.
Yeah, sure. And it's male based. So yeah, it's good for both genders and hopefully be helpful.
Yes, yes. So I want to emphasize there's hope. There's hope for pain. There's hope for bladder dysfunction. There's hope. If you have any further questions, you can reach out to myself or Nicole with @PelvicSanity. If we didn't get to your questions, we'll be giving you some written responses on our stories. And on my story, I created a highlight called ICPBS. And so all of those highlights, all of those story responses that we're going to give, I'm going to tag and put in my story highlight.
Oh, perfect.
So you could go and access it there too, and I'll be tagging you as well. So we'll work together. Oh, we have Turkey here. Hello, Doctor. Oh, that's wonderful. How exciting. We're just finishing up. We had a great discussion on interstitial cystitis, and thank you so much, everybody, for joining us. Nicole, thank you for your expertise. I look forward to doing this again. And
for sure.
Feel free, everybody, to reach out with questions. That's what we're here for. Thanks again. Take care. Bye-bye.